Hello, it's Dr. Greg Marion here at One Spine Chiropractic. Today we're going to be discussing a condition called sciatica. Sciatica is a condition that we have radiating pain from that lower back and buttock area down the leg all the way down to that calf. Sometimes you feel burning, radiating pain, numbness, tingling. Those are all signs that sciatic problem is not happy with you. So what we want to do is we want to address the problem with chiropractic, specifically a chiropractic adjustment. Because what happens is a lot of times the bones get misaligned, that puts pressure on the nerve. When you put pressure on the nerve, it causes some inflammation and radiating pound down the leg. So there's a few areas that we look in the spine for that. So we're going to evaluate the 5 bones of that lumbar spine because we have nerve roots that actually come out and bundle up right behind the buttock and make up that sciatic nerve. Another area of the spine we're going to look for is misalignments is the pelvic. So your sacrum and your pelvic bone on each side is your foundation. So when your foundation gets rotated or out of place, that also might put pressure on that sciatic nerve, causing the radiating pain down the leg. So with our first treatment option with sciatica is the chiropractic adjustment is a diversified, more hands-on adjustment. So what we're gonna do is we're gonna palpate first of all with the chiropractic exam and figure out where the bone is stuck and misaligned. Depending on where that bone is stuck, that's the area that's putting pressure on the nerve. So what we wanna do is adjust that, get pressure off the nerve, and let the nerve actually heal itself up and get the relief of the symptoms we're having. So we're gonna demonstrate that adjustment right now. So Clarissa, I'm gonna have you lay on your side facing this way. And we're getting in a nice comfortable position, and then we are actually going to palpate the area that's stuck right there. So we're going to get that leg up a little higher. We're going to go here, and then we're going to have the patient just relax, and I'm going to lean her in toward me. Good. So that bone is back in place, less pressure on the nerve, the body's able to heal and feel better, and let the body get the results it needs. So let's go ahead and do the other side. So here's the bone that is stuck. We're gonna have the patient relax, lean her in toward me. Good, good popping. Everything is back in place. Let me help you up. So what's gonna happen is that, a lot of patients that are inflamed and in a lot of pain, they don't need the aggressive manual adjustment. So what they prefer is something less, invasive and a lot less force. So what we use is an instrument called an activator. So this activator helps me get that bone back in place, really gentle and specific to get pressure off the nerve so we get the relief from that sciatic pain causing issues. So same thing, what we're doing with our chiropractic exam is first of all, we're palpating to find the area of the lower back that is stuck. So when we find that area of the lower back that is stuck, we get the device right on there, click, bone gets back in place, takes pressure off the nerve root, sciatic pain's gonna get relief. Also the muscle spasm that's surrounding that area gets relief as well. So if you're not a big fan of the pop-in and the aggressive, this is a great option for us called the activator method, which we practice here at our office. So another option is the Thompson technique. A lot of patients prefer a low force adjustment. This helps us get the pressure off the nerve, get the bone specifically in the right position where I need to, so the body can heal up, get rid of that sciatic nerve. So first of all, what we're gonna do is we're gonna evaluate with the chiropractic exam and palpate which areas are stuck, causing some issues. And then I'm gonna have the patient lift this leg up nice and straight. Good, back down. How about the left one? Back down. Which one's heavier? And typically the area that's heavier, that's the one where the sacrum and the pelvis is stuck, but also putting pressure on that sciatic nerve. So what we're gonna do is use this table to get that bone back in place. So I'm gonna have the patient cross her left leg over for me. We're gonna make our contact point where that bone is stuck. Come up. One more. Good, just put that leg straight, and we'll work on the bone right above that that's stuck as well. All right, let's lift that leg up one more time. Great. So there the patient has better range of motion, less restriction, but more importantly, less pain going down that sciatic nerve. So if you have any sciatic issues, call our office to get the relief you need. We'll do a thorough evaluation and get you the treatment options you need. Thank you.